Hey guys, hope everyone is doing well and staying safe out there. Can't wait to see all of you soon. So I decided to do my research paper on cerebral palsy. I hope to one day work with kids, and so I think that having a knowledge of it is going to be very important for me. So let's get started. So cerebral palsy is described as a group of disorders that affect a person's ability to move, maintain balance, and their posture. So when you break it down into word parts, because I kind of had to break mine down just to understand a little bit better, cerebral is pertaining to the head, and then palsy is referring to weakness and utilizing and issues utilizing the muscles. So there's two types. You have congenital and acquired. So congenital is when there is an injury to the child's brain prior to birth or during birth. And then you also have acquired, which is injury to the brain after birth or during the first 2 years of life. So these can be brought on by infection, TBIs, anoxia, or ischemia. Some of the triggers that can affect the disease process include any kind of maternal infection that the mother may have had, bacterial meningitis, severe jaundice, which we know that's yellowing of the skin, viral encephalitis, and falls. So some of the signs and symptoms that you may see with patients who have cerebral palsy, they're going to have probably unusual muscle tone, difficulty with coordination and motor control. They may have some incontinence issues, visual impairments, speech disorders, and they may have seizures as well. So there are some medical treatments that they can do if orthopedic surgery is needed. Usually you will see that in patients to help decrease their pain as well as overall function, trying to improve that. Some of the indications of why you would do this is if they have a history of subluxations or dislocations, a curvature of the spine, and if they're having any kind of like respiration issues, significant contractures, and difficulty with hygiene. They may also be prescribed medications to help with pain, any kind of illness or injury that they may have at that time, medications for behavioral issues, bladder and bowel issues as well. They can use some assistive devices like wheelchairs and walkers to kind of help get them mobile and also increase their independence as well. I know speech, physical, and occupational therapy, those are all like a big part of treatments for patients with cerebral palsy as well. In one of my articles, or sources I should say, it's the Cerebral Palsy Guide. It said that physical therapy is the first step in treating CP for many patients. It said that physical therapy has shown to alleviate pain, decrease stiff muscles, so preventing contractures, increasing their strength, balance, coordination, and improve the overall mobility of the patient. So whenever you are, trying to figure out, what is going to be best for this patient, it's important to make sure that it's in your plan of care and also kind of see what the goals are for the patient. So you can use, TheraBands, exercise balls, and you can use modalities as well. Some of the ones that are really big are hydrotherapy, cryotherapy, thermotherapy, and e-stim. What these all can do are either help stimulate flaccid muscles or to decrease spasticity. It just kind of depends on which one you're going after. It is also important to make sure that you are looking to see the patient's chart, make sure that you're not doing anything that's contraindicated because we don't want to hurt the patient, but it is important to also know that a lot of these patients are going to be at a greater risk of falls. And so educating the family and the patient as well about the risk of falls is very important. Let's see. And having them do some home exercise programs is going to be great too, because it can kind of get the family involved. That way, if they have younger siblings, their younger siblings can get involved and almost feel like it's kind of like a playtime for them, and just bring the family closer together. So my research article that I found was a randomized control trial that studied the efficacy and of treadmill training on walking and quality of life of adults with spastic cerebral palsy versus traditional physical therapy. So you had 17 men and 13 women who were chosen to be involved. The experimental group utilized treadmill training, while the control group used traditional physical therapy. This was done for 8 weeks, twice a week. So at the end of the study showed that treadmill training without body weight support would help to improve walking speed and endurance in adults with CP. However, it would not be more effective than traditional physical therapy in increasing gait performance and quality of life in adults with CP. So basically what that says is that physical therapy not only helps with gait, balance, and coordination, but it also helps them live life more comfortably and less pain, and giving them a sense of independence as well. So there wasn't a set life expectancy for CP. It kind of depends on the severity of the illness on the patient, but it's non-progressive. This diagnosis is non-progressive, so it won't get worse over time, which is great. But it is important that we try to help make these patients as comfortable as possible, just to kind of give them a greater sense of belonging, and that they can live life to the fullest. But yeah, so that was my research on cerebral palsy. If you have any questions, you can leave them down below. If not, I look forward to seeing you guys, and I miss you, and hope you're staying safe, and talk to you later. Thanks, guys.